Hello everyone. Very good evening to all of you. I am Dr. Gagandeep Kaur, consultant dermatologist, cosmetologist and hair transplant surgeon at Mahabir Dal Hospital, Bathinda. Today I will be discussing the various cosmetic procedures in dermatology. Now, first of all, what are these cosmetic procedures? These are those procedures which are performed by or under the guidance of a dermatologist, which results in the improvement of your appearance and texture of the skin. These cosmetic procedures, they specifically targets various skin issues like acne or pimples, acne scarring, post-traumatic scarring, then many types of pigmentation like melasma, post-inflammatory pigmentation, post-acne pigmentation, tanning, dullness, various aging changes like sagging of the face. There is superficial and fine wrinkles and deep wrinkles. It also targets unwanted facial hair on the unwanted facial hair and the hairs on the other body parts. These procedures also focuses on the hair loss. So there are various anti-hair loss procedures. I will give you brief about some of the most common procedures which we do in our day-to-day life. So first and foremost, the most common and most reliable procedure is chemical peeling. What is a chemical peeling? In chemical peeling, we apply a chemical agent or a formulation on your skin which will remove or exfoliate the damaged superficial layer of the skin, which will give you more rejuvenated, refreshed, smooth as well as less pigmented look. So chemical peelings gives wonderful results, but whenever I talk about chemical peeling with my patients, many of them they think that now doctor will apply some chemical on my face and that will ruin my face. See, I will try to clear this perception that the chemical peels which we use in our practice, they are not those harsh chemicals which will damage your face, right? They are actually the fruit derivatives. Fruit derivatives like glycolic acid is obtained from sugar cane. Similarly, citric acid from the citrus fruits, tartaric acid, mandelic acid from bitter almonds, lactic acid from the sour milk. So they are they are just the derivatives of the fruits, but they gives you some kind of exfoliation. So these which I have mentioned, these are water soluble. So they are alpha hydroxy acids, and the other are the beta hydroxy acids like salicylic acids, which are lipid soluble. So these chemical peels, they come in different strengths. The amount of the exfoliation depends upon the type of chemical peel, the percentage we are using, the number of layers applied, or the time of the application. So the chemical peels gives different kind of exfoliation, and accordingly they are of three types mainly, like superficial, which will give mild or no exfoliation. There are medium depth peels which will give medium exfoliation, and there are some deep peels which can give very good exfoliation. Now, if you don't want to go for exfoliating peels, then there are options for you also. Then there are some non-exfoliating peels like lactic acid peels, arginine peels, ferulic peels. So these peels can be tried. They also give excellent results if you have an important meeting in a near future, or you have an important function to attend, right? So if you can bear the downtime, that is the amount of peeling your skin is taking the time for the peel, then chemical peels are an excellent option. But yes, there is a downtime. These peels, they are to be done only by a dermatologist. Your dermatologist can better guide you regarding the suitable peel according to your skin type and your skin concern. So never try a chemical peel at home on your own, or with or even some inexperienced hands. Always go to a dermatologist if you want some chemical peels, and you will need multiple sessions to get good results. After that, the other is the microdermabrasion. Microdermabrasion is also known as skin polishing, and in microdermabrasion we do mechanical exfoliation of the skin. As we did chemical exfoliation with chemical peels, here mechanical exfoliation is done. But microdermabrasion procedure is very safe. It can be performed on any skin color and almost every skin type. So there are two types of microdermabrasion. One is where we use mechanical exfoliator with aluminium oxide crystals at high pressure. They are forced onto the skin and then suctioning is done. And similarly, there is second, that is diamond toe microabrasion, in which a probe with multiple diamonds, not those diamonds, they are used, which will cause the further suctioning. So in this way it removes the dead superficial layer of the skin, the damaged layer of the skin. This is an excellent procedure for the skin rejuvenation. There is no downtime, therefore this procedure is versatile. That is, it can be performed with various other cosmetic procedures including lasers, chemical peels, botox and fillers. So now there is hydrofacial. Hydrofacial is in very hype, but hydrofacial is actually nothing. It is just an advanced type of microdermabrasion. But yes, it has added advantage over the microdermabrasion, because in hydrofacial we use oxygen as well as aqueous solutions to infuse into the skin, which will at supersonic speeds, which will further remove the superficial layer of the skin. So this hydrofacial has added advantage of, along with exfoliation, there is hydration, and we can also add antioxidant to the skin with the same pass. So hydrofacial treatment is very good for the people with sensitive skin or the acne prone skin. And this will not give you some any visible exfoliation as the chemical peels does, but yes, they can give you much better results than your regular parlor, salon or facials. After that, there is a procedure which is known as microneedling. This microneedling is actually, in microneedling we perform we create some micro injuries to the skin, due to which the old collagen strands break down and there is formation of the new collagen strands. Therefore it is known as collagen induction therapy. In this microneedling, it can be performed with a manual derma roller device, which has multiple tiny needles. Then there is a derma pen, and the latest is the microneedling radio frequency. In microneedling radio frequency procedure, along with microneedling, we also deliver radio frequency energy to heat up the dermis. So the results of the microneedling radio frequency are very much better when we compare it to the derma rollers and derma pen. And the most important thing about microneedling radio frequency is that it is color blind. So yes, it can also be performed on any kind of skin color. Microneedling radio frequency can be combined with PRP to treat acne scars and stretch marks, and it also gives wonderful results. But this procedure is painful, so you will require a topical anesthesia before performing microneedling radio frequency. Then there are a few lasers. Lasers have definitely revolutionized the field of dermatology. We have so many lasers and so many indications of the lasers for which we use them. But I will give you a brief about some the most common lasers, and the first one is the laser hair reduction. Laser hair reduction is done for the unwanted facial hairs or to reduce the growth of the hairs on the other body parts. If you are planning a laser hair reduction, you need to know few things. Like, actually laser reduction is quite a misnomer, because it is not laser hair removal is quite a misnomer, because it is actually a laser hair reduction. We can call it permanent laser hair reduction, or we can also call it long-term laser hair reduction. So when you plan a laser hair removal process, you need to understand that you will require multiple sessions, and after that you may require some maintenance sessions too. So you need to consult your dermatologist before you plan laser hair removal. What happens in this laser hair removal? Laser beam is targeted on the melanin of the hair follicle. So only hair follicles which have melanin, that means only black hairs, get affected by laser hair removal. If you have white hairs, then don't think for the laser hair removal, because you will not get any benefits. But yes, black, thick, coarse hairs get excellent results with laser hair removal. Therefore, the melanin is present only in the anagen hairs, and anagen hairs are only 80 to 90% of the scalp. I mean, yes, that's a lot, but still you will need multiple sessions, because to get the appropriate or the required laser hair reduction, you will definitely need many steps. And if you don't have any hormonal imbalance, then you will get the optimum results after say 6 to 8 sessions. But if you have some hormonal imbalance or the problem of PCOD, then you need to see your dermatologist. He or she may advise you some lab investigations, and then he or she can plan your laser hair removal. So laser hair removal is to be done only by a qualified dermatologist, because otherwise you can get burning or scarring. Then there are few other lasers, like there is Q switch laser, which can be used for photofacials, carbon facials. Then there is tattoo removal lasers, for which the various black and dark blue pigments can get very good results. But if you have colorful tattoos like red or yellow, then results will not be that good. And it also depends upon the type of the tattoo you have. So then there is a very good laser, that is CO2 laser. This laser has excellent results, but there is a definite downtime of about 7 to 10 days after CO2 laser, because it is an ablative type of laser, right? It is a fractional laser. So a fractional laser beam is targeted onto the skin. So there will be areas of the injured and uninjured skin. So the uninjured skin will help in healing of the injured skin. So that's how the CO2 laser works. But yes, it is also a painful procedure, and you will need to put some topical anesthesia before going for the procedure. Then this CO2 laser, it is very useful for the stretch marks as well as the acne scars or other post-traumatic scars. Then after lasers, there comes anti-aging treatments. Now anti-aging treatments, see, I know aging is inevitable, everybody knows, but why not age gracefully when you have options, right? Because in this modern world we need to look more gracefully, we need to age more gracefully, right? So then you have many options, like there are Botox, there are fillers, there are thread lifts. These are the non-surgical facelift methods, means they are non-invasive or minimally invasive methods. They are bedtime procedures, and you can get quick injections with Botox, fillers, or thread lift is like 15 to 20 minute procedure only. What happens, what we do in Botox, we inject botulinum injection into the muscle which is causing wrinkles. So it causes it stops the movement of the muscles temporarily for some time only, due to which our skin becomes smooth, and we become free of wrinkles. When we talk about fillers, say with aging, we have some malar fat pads, and they get displaced as we age. So we need to keep them in place. So in that case, we use hyaluronic acid fillers, which are completely safe to fill that gap. And fillers have got excellent results, and results last for about 1 to 2 years. Then third is the thread lift. Thread lift is an excellent procedure too, but yes, the results last for a short time, but so does the cost. And in this thread lift, we put threads inside your skin, and then we pull it, which will give a lifting effect to our face. It's been said that after the age of 25 to 30 years, you start thinking of the anti-aging treatment. But when you reach 50, then you start thinking of the more hydration treatment. So a filler is a kind of treatment which actually hydrate your skin too. Not only it gives the fulfilling effect, but it also hydrates our skin, because with age, the hydration of the skin decreases. So a filler with time absorbs more water, and results become much better. After that, there are CO2 laser rejuvenation, and PRP facial can also help with anti-aging. So it was all about anti-aging. In PRP facial, what we do, PRP is extracted from your blood is extracted from your arm, and then that blood is centrifuged and the platelets are collected, which is usually more than your baseline platelet count. And then the growth factors, they can be injected subdermally, or they can be infused into your skin with the help of mesopan, dermapan, or derma rollers, and that gives excellent results. And this procedure is also known as a vampire facelift or kiss shot also. This was all about the anti-aging. Now when we talk about the hair loss procedures, there are various procedures like PRP, which can be done for the hair fall or hair loss, because PRP, it increases the blood supply to the hairs, and it also prolongs the anagen phase of the hair cycle. There is mesotherapy, there is triple LT, low level laser light therapy, which also increase the blood supply of the scalp and results in the regrowth of the new hairs. So this was the basic about the various cosmetic procedures. If you want to ask for any query, or if you have any question in your mind, you can ask. So I'll now see the questions.